Hello everyone, it's Dr. Lee. In my world, precision is everything. Whether I'm performing a delicate excision or a simple extraction, the smallest detail can make all the difference. It's not just about the procedure itself, it's about ensuring the patient receives the best possible care from start to finish. And a huge, often overlooked part of that patient journey is what happens after they leave my office, the medical billing process. It might not be as glamorous as what you see on TV, but it's just as critical. A tiny error, like a misplaced decimal or a single wrong digit in a code, can have surprisingly large consequences. These aren't just minor clerical issues, they are financial roadblocks that can disrupt the entire healthcare system. Even the most seemingly insignificant mistakes can lead to denied claims, which means the practice doesn't get paid for the services we've provided. Worse, it can trigger compliance scrutiny from payers or government bodies, leading to stressful and time-consuming audits. For patients, it can mean confusion and unexpected bills. For providers, it means delayed payments that affect cash flow and the ability to run a practice smoothly. The ripple effect of one small error is truly astounding, impacting everyone involved. That's why I believe it's so important to shine a light on this topic. Just like I educate my patients about their skin, I want to help my fellow healthcare professionals understand the intricacies of billing. We need to be as diligent with our paperwork as we are with our patients. To do that, we have to know what to look for, what pitfalls to avoid, and how to build a system that catches these errors before they cause problems. Let's look into some of the most common claims pricing mistakes made in today's healthcare marketplace. The first hurdle, and one of the most common, is something that happens right at the front desk: incorrect patient information. You might think a simple typo in a patient's name or a slightly incorrect date of birth is a minor issue. But in the world of medical claims, it's a guaranteed denial. Insurance systems are incredibly precise. If the name on the claim doesn't exactly match the name on the policy, the system will automatically reject it. The same goes for an outdated address or an old insurance ID number. It's like trying to open a lock with the wrong key. It just won't work, no matter how close it is. It's truly surprising how often this happens. In fact, studies show that a significant portion, around 10% of all denied claims, can be traced back to errors made during the patient intake process. This isn't just about a single denied claim that needs to be fixed and resubmitted. It creates a domino effect of delays. Your billing staff has to spend valuable time investigating the denial, contacting the patient to get the correct information, and then going through the entire submission process again. All of that extra work and waiting for a payment that should have come through weeks ago starts right at the beginning, with a simple data entry mistake. Now let's talk about something that requires a lot of expertise: coding. Every single thing we do for a patient, from a consultation to a complex procedure, is translated into a set of universal codes: CPT for procedures and ICD for diagnoses. If these codes are wrong, the claim is in trouble. Using an incorrect CPT code might not accurately reflect the service provided, leading to underpayment or an outright denial. Similarly, if the ICD-10 diagnosis code doesn't support the medical necessity of the procedure code, the payer will flag it immediately. It's a language, and you have to be fluent. The complexity doesn't stop there. These code sets are updated annually, so using an outdated code book is a recipe for rejection. Then you have modifiers, those little two-digit codes that add specific details to a procedure. Forgetting a necessary modifier or using the wrong one can completely change the context of a claim. Even worse, consistent errors, like using a higher-level code than is justified by the documentation, a practice known as upcoding, can trigger serious audits and even accusations of fraud. This is why regular code reviews and continuous training for billing staff are not just best practices. They are absolutely essential for compliance and financial health. In medicine, we have a saying: if it wasn't documented, it wasn't done. This is especially true when it comes to billing. A claim is essentially a story you are telling the insurance company, and your documentation is the evidence that backs it up. If that evidence is incomplete or missing, the payer has every right to deny the claim. They need to see the full picture. This could be anything from missing clinical details in the physician's notes to a failure to include the formal admission order for an inpatient stay. Every piece of the puzzle must be there. Think about it from the payer's perspective. They are being asked to pay for a service, and they need proof that the service was both performed and medically necessary. Without detailed notes, signed orders, and clear justifications, the claim is just an empty request. This forces your team into a reactive cycle of chasing down physicians for more information, amending records, and resubmitting the claim, all of which delays payment. It's crucial to have systems in place that ensure all required documentation is present and accounted for before the claim ever goes out the door. Proactive checks are always better than reactive fixes. Some medical services, especially more expensive procedures, imaging, or non-emergency hospital stays, require a green light from the insurance company before they are even performed. This is called prior authorization, or pre-authorization. It's the payer's way of managing costs and ensuring a service is appropriate. Failing to secure this approval is one of the most frustrating and financially damaging mistakes a practice can make. If you provide a service that required prior authorization without getting it, the insurance company is very likely to refuse payment altogether. This isn't a situation where you can easily apologize and fix it after the fact. The authorization part of the term is key. It has to happen to the service. This can leave the practice with a huge uncollectible bill, or it can result in the patient being unexpectedly responsible for the full cost, which is a terrible experience for them. To avoid this, robust pre-service workflows are critical. This includes using automated eligibility checks that can flag services requiring authorization and implementing checklists for staff to ensure every box is ticked before the patient is ever scheduled for the procedure. It's a crucial step that you simply cannot skip. This one might sound like an obvious error, but it happens more often than you'd think. Duplicate billing is exactly what it sounds like. Submitting more than one claim for the exact same service, for the same patient, on the same date. Sometimes this is a simple accident. Maybe a biller resubmits a claim because they thought the first one wasn't received. Or a system glitch causes two identical claims to be sent. It could even be that two different departments in a larger facility, like the physician's office and the hospital's facility billing, accidentally bill for the same component of a procedure. Regardless of the intent, payers have sophisticated systems designed to catch these duplicates instantly. When a duplicate claim is identified, it's automatically denied. While a single instance might just be an administrative headache to sort out, a pattern of duplicate billing can raise serious red flags. Payers may see it as a sign of disorganized, sloppy billing practices, which could increase scrutiny on all of your future claims. In a worst-case scenario, it could even trigger an audit or an investigation for potential fraud, as it can be misinterpreted as an attempt to get paid twice for one service. It's a costly mistake that underscores the need for a clean, organized, and transparent billing process. A patient's insurance coverage can change at any time. They might switch jobs, their employer might change plans during open enrollment, or they may have simply forgotten to pay their premium, leading to a lapse in coverage. Assuming the insurance card a patient presents is still valid without verifying it is a significant gamble. One of the most common reasons for claim rejection is simply that the patient was not eligible for coverage with that specific payer on the date the service was provided. It's a simple fact check that, when missed, brings the whole reimbursement process to a halt. This is another error that originates at the front end of the patient encounter. Relying on a patient to know the exact current status of their coverage is not a reliable strategy. The best practice is to verify eligibility electronically before every single visit, or at the very least for new patients, and at the start of a new year. Modern practice management systems can do this automatically, sending a quick query to the payer's system and getting a response in seconds. This simple automated step confirms active coverage, identifies the correct payer to bill, and provides details on copays and deductibles, preventing a world of back-end problems and ensuring you get paid correctly the first time. Even if you get the patient's information right, the codes are perfect, and you have prior authorization, a claim can still be denied if the payer disputes the medical necessity of the service. The insurance company acts as a gatekeeper, and they will only pay for treatments and procedures that they deem medically necessary according to their specific policies. If your documentation doesn't clearly and convincingly explain why a particular service was needed for that patient's diagnosis, they can and will refuse to pay for it. This is a very common point of contention between providers and payers. This is where the quality of a physician's clinical documentation is paramount. It's not enough to just state the diagnosis and the procedure. The notes must paint a clear picture, outlining the patient's symptoms, the failure of more conservative treatments, and the clinical reasoning that led to the chosen course of action. For example, simply billing for a high-level MRI without documenting the specific neurological symptoms or physical exam findings that justify it will likely lead to a denial. Training providers on how to document for medical necessity is just as important as training them on clinical techniques. It's about building an undeniable case for the care you provided. As we've seen, the path from providing patient care to getting paid for it is filled with potential pitfalls. From the front desk to the final code, healthcare claim pricing errors cost practices an enormous amount of money and time. Each denial represents delayed revenue, but it also represents hours of administrative work to investigate, correct, and resubmit the claim. This is time that could be spent on patient care or improving practice operations. These aren't just small clerical issues. They are significant financial drains that impact a practice's stability and ability to serve its community effectively. Fixing this isn't about finding one magic bullet. Avoiding these common billing mistakes requires a comprehensive approach that combines three key elements: great technology, stellar training, and proactive professionals. You need systems that can automate verification and flag potential errors before a claim is ever submitted. You need a team that is continuously educated on the latest coding changes and payer policies. And you need a culture of diligence, where every person involved in the revenue cycle understands their role in ensuring accuracy. It's about building a resilient process that protects your practice's financial health. When your team is focused on providing the best care, you need a partner who can ensure your billing process is just as precise. Reduce medical billing errors with Micro-Dyn. For claims pricing assistance and RCM solutions, Micro-Dyn offers precise claims pricing, payment integrity tools, and automation for faster, more accurate claims resolution. They provide the technology and expertise to help you navigate the complexities of billing, so you can focus on what you do best, taking care of your patients. Thank you for watching.